Hi, my name is Dr. David Purvis. I'm a psychologist and I work in Reading in Berkshire in the UK. Yesterday I had a very busy clinical day, but nice day in a way because I discharged 3 clients. One was suffering from post-traumatic stress disorder and that took 6 sessions to resolve. One was struggling with severe anxiety and depression and that took 8 sessions to resolve. And one was struggling with severe anxiety and moderate depression and that took 7 sessions to resolve. And those sessions were spread out normally over about 3 months because of holidays and work arrangements and all sorts of other kinds of things. Now, those, in my opinion, are fairly typical outcomes for a competent cognitive behavior therapist, clinical psychologist, counseling psychologist. Okay, the cost of that treatment on average was between 800 and, or between 900 and 750, depending on who's paying the bill, if you like. So a clinically effective treatment for depression and anxiety, on average about 750 to 800, and perhaps a little bit more depending. Okay, now I don't say this to boast, I simply say it to kind of reinforce the actuality that cognitive behavior therapy is a very powerful and reasonably easily implemented treatment strategy for panic, anxiety, depression and stress. And I've driven, I always think a picture is a good thing to kind of help explain, but let me just show you this picture here. We can see that on the 1st of February, this client came in and they had severe anxiety and severe depression as measured by the Hospital Anxiety Depression Scale, a HADS, and it's a common scale, and you have to measure these things as a professional psychologist. It's just considered to be best practice, really. And they had 7 sessions altogether, and those 7 sessions, let me just see if I can show this to you a bit better. Those 7 sessions resolved on the 5th of May 2019. So 7 sessions over approximately 3 months. Now, CBT can be hard to get. CBT is very effective. CBT can be somewhat expensive if you're paying for it for yourself. But even if you think about it, right? If you're struggling with severe anxiety and severe depression, and you could have your depression and anxiety resolved so you could be cured for, let's say, £800, you might go, well, actually, that's a good deal. Yes, please, because the kind of human cost of anxiety and depression, particularly severe anxiety and depression, is horrendous. It's just difficult to live your life, difficult to find enjoyment, it's difficult to relate, to connect to people, it's difficult to play with your kids, it's difficult to do anything, really. So you might say, well, that's a good deal. Okay, but here's the thing. Suppose you could get all of the tools that I would use in CBT and you could apply them to yourself without actually having to see a therapist. Now, I've developed an approach over, in fairness, over virtually 20 years called Active Self-Help CBT. So I've taken all the tools and resources that I use to do this treatment and to get these results, and I've turned them into a program that you use so that you get all the tools yourself and you can use them at home, on your computer, on your tablet, on your phone, whatever you like, right? And these tools are a brilliant way of implementing everything that a therapist would do in session, but in fact without having to have a therapist. So if you want to see what these tools are, if you want to check out Active Self-Help CBT, I made it really easy for you. And so you'll find a link probably below this video that will take you to a place and you can check out Active Self-Help CBT, not for £800, but for £1 for 2 weeks, right? So you get an opportunity to use Active Self-Help CBT for depression, for anxiety, for panic and stress. You get to use all of the tools that you require for 2 weeks for £1. If you carry on, it costs about the price of a Starbucks a day, but you get the opportunity to check out Active Self-Help CBT. Now, Active Self-Help CBT is the only strategy that you can find that tells you what to do, it tells you how to do it, and it shows you why it's important that you do this thing. It clarifies the process of panic, anxiety, depression, and stress so that you understand what's going on. Now, when I look at Facebook and all sorts of other things, people are always saying, I don't understand, why do I have this, what can I do about it? The answer to all of those questions lies within Active Self-Help CBT. So, if you want to, if you struggle with panic, anxiety, depression, and stress, and you want to have a different experience, and you're prepared to spend £1, 75 cents US, I don't know, maybe $1 Canadian. I mean, not very much. 50p a week. If you're prepared to spend £1 and to put a little bit of time and effort into recovering from panic, anxiety, depression, stress, then this is a great opportunity for you. I mean, it's £1, right? Now, the thing that these clients had, and the thing that you might not find in other kinds of therapies, and the kind of an important thing is, I'm a big fan of setting homework. So I always set homework for people, and my motto is a little bit every day. If you do a little bit every day, you get the outcomes that I just showed you on the board. And that's what Active Self-Help CBT gives you. It gives you a little bit every day. If you spend 10 minutes a day or less focused on resolving panic, anxiety, depression, stress, you will get a different experience, and you'll probably get a great outcome. And really depends on how focused and how motivated you are. So, if you want to change your experience, if you want to get access to the stuff that really makes the difference, then you have to spend £1. And I don't think that's such a bad deal. So I look forward to seeing you on the inside of the fantastic Dr. Purvis online programs, so the Active Self-Help CBT programs. And if you have any comments or questions, please let me know. I'm here to help. Thanks for taking the time to watch and listen. You'll find the link, click on the link and start. Nothing to stop you, absolutely nothing at all. You can start immediately, and as soon as you start, you're on the journey to wellness.